In this video, I'm gonna break down all the upper body muscles that you need to know to either pass your exam or succeed as a new personal trainer. Let's jump in. Coach Joe Drake here with the Axiom Fitness Academy. If you're joining me for the first time, we help personal trainers like you succeed in the industry, and I know muscular anatomy, especially if you're still studying for your exam, muscular anatomy is one a lot of people struggle with. So in this video, we're gonna break down all the upper body muscles you need to know. Not every upper body muscle, because the truth is there are hundreds of muscles, and right now, based on where you are, you need to know the most important ones, the ones that are gonna drive exercises. I will say this is part 3 of a 3-part series, so if you want more information on lower body muscular anatomy or core muscular anatomy, check out the links in the description below. Let's dive in. We're starting with what we call the anterior view, front side of the body. One thing I want you to take away from this video, especially when we look at chest versus back, right, anterior versus posterior, there are gonna be more layers of muscle on the back side. Doesn't mean you have to train the back more, but truth is there's more muscles back there. So when we start thinking about things like posture and position, maybe one reason to really start to better understand what's going on the back side. But from the front side, we're gonna talk about some of the common ones, right? Right now I'm shooting this video, it's Monday, it's chest day, which is the best day. And so the first one we're gonna cover, pectoralis major, chest muscles. Now the cool part is as you guys see this visual, it starts to become a lot more apparent how kind of crossover and interconnected some of our muscles are. Like we've got the pectoralis major, and you can see we've got a couple different directions of fiber run. Really, if you look at origin and insertion, which you don't need to know, right? We have like attachment to the clavicle, the sternum, but for the most part, you can think about the pecs is starting right here. Then we have kind of a lower fiber run, right? Where it's kind of going slightly upward, right? A little bit more of an angle. We have straight across, and then we kind of have down. And this gives rise to the idea behind doing like flat bench press, decline, incline. It is the same muscle group, but we do have some different fiber angles. And kind of the cool part here too, and I'll show you guys on the screen, is the pecs, they actually come in and they almost like rotate as they attach to the inside of the humerus. So when we think about motions, things like chest flies, this might be one of the most natural motions for the pecs, bringing that arm across the body, but different angles of pressing, from chest press to overhead press to incline press, all these things, the pecs are gonna be involved in some capacity. So I'll show you guys as we isolate this here too. You can see it kind of like wraps around, right? So you see that fiber run across the body with our pectoralis major. And this is gonna be a big prime mover, right? One of the major muscles when we're talking about pushing exercises. So a common one that we're gonna wanna train. This is also one sometimes which might be a little tighter for those who've got some really forward posture in the chest and shoulders. Doesn't mean we don't train it, but it means we wanna train it with big full range of motion, big full stretch. So first muscle we're going through here in the upper body, you got your pectoralis major. Now, this one's kind of a harder one to think about. How do I train it? We have pec major. We also have pec minor, which sits underneath. And this was an interesting one, right? Pectoralis minor. This one really creates some connection. You can see here from the origin, the anterior ends of our 3rd to 5th ribs. So we've got rib attachment connecting up to really like the coracoid process of our scapula. So this is not one that you might think of as targeting as much with primary muscles, but this is definitely one for those who may have some shoulder and postural issues. It's a little deeper. Sometimes this one can be a problem area of either being a little overactive or a little bit tight. But either way, we've got the pec major. If we look a little deeper underneath, we have the pec minor there as well. And this is where it starts to show all the muscles that are going to connect up into the shoulders. So what I do want to do is I want to go back for a second here so you guys can see as we get on top really with our pecs. Next up I'm going to talk about is going to be our deltoids, really mostly because as you see right here from our pecs up into our deltoids, it almost kind of starts to look like the same muscle fibers. They're definitely different muscles, but they really connect up with one another. And the reason I say that is because you really can't take away altogether. When I'm doing pressing exercises, you know, again, especially horizontal pressing, yeah, I may be targeting more of my chest, a little bit more of my triceps, but I'm gonna be getting some deltoid involvement no matter what, because it's gonna cross over. And especially as I go from horizontal to more vertical in between, it's kind of like a spectrum. I'm going from like more chest to more shoulder, and it just crosses over. So these muscles definitely work together. You can see here too, the deltoids that sit on the side, it is one muscle group, but we kind of talk about it in 3 little segments. And the app that I'm using here for you guys is a little bit more medical, so you'll see it's called the clavicular part of the deltoid. You might also know this as your anterior deltoid. So when we think about like front raises, this is gonna be more involved. This is definitely gonna be also more involved when we start to get into like incline and overhead pressing variations. And as we go further to the lateral side of the body, we come to, again, what the medical community might call the acromial part of the deltoid. We might call it more a medial or lateral deltoid. So when you're thinking about things like more lateral raises, it's gonna be a little bit more targeted to that lateral component of the deltoid. And then on the back side, we flip right back around and we have a little bit more of what we call our rear delt. Right here you'll see scapular spinal part of the deltoid muscle, but we call this more our rear delt. And the reality is, guys, especially training knowledge, the shoulders are involved in almost everything we do. They're involved in lower body, when we're holding weights, when we're pushing, when we're pulling. So this is definitely an area of the body that's very easy to overwork. And just paying attention to the fact that even though you might have a shoulder day in your training, right, for a client who's training like twice a week, well, guess what? The shoulders are involved with pushing and pulling. We still can do some direct overhead work, but these muscles are gonna be involved in pretty much any exercise where we're holding weights, upper body or lower body. They're gonna be stabilized and they're gonna be working. All right, so we covered here on the anterior component, our pectoralis major. We looked a little deeper underneath for the pec minor, and then we covered the deltoids here. All right, very common muscles that we need to know. And like I mentioned, the deltoids, they're not only going to be involved in like isolated shoulder motion, but as I'm pushing and pulling at different angles, we have a different involvement. They're definitely going to be involved in some capacity. All right, so staying with our anterior view, the front side, one of the other major muscles, right, one of our mirror muscles, right, I started off some of the video with a little flex, the biceps, baby, the biceps brachii, biceps brachii. All right, we got to know these anatomical versions. And the thing is as you see this right here, you can see on the image, we've got two heads. All right, we have the long head of our biceps brachii, and we have our short head. All right, biceps, two heads, easy way to remember it. And you can also see, it looks like the bicep runs up under the shoulder, and it does. It does. What I'm going to do here is I'm actually going to pull away. We're going to hide the pecs. We're also going to hide the deltoids. So you guys can see, boom, now we see where the bicep actually happens and crosses over. And interestingly enough, this is where the bicep, we commonly think about elbow flexion, right? Bicep curls. That's gonna be the primary motion most of us are gonna train. But you can see within these two heads, we have one of our heads, this long head, that actually crosses up over the shoulder, right? It sits right inside this, what we call like bicipital groove, and crosses over across the shoulder joint. And the other head, right, this short head, actually attaches to that coracoid process of our scapula. So both of them cross over, which means they're not gonna be prime movers, but as I think not just elbow flexion, right, but also shoulder here, we talk about shoulder flexion, it's gonna slightly be involved there, all right? So that could be different shoulder positions. Funny enough, if you guys have ever done like incline bench curls where I'm a little bit more stretched in this position versus in front like a preacher curl, those will hit the biceps in different ways, all right? But it's also one of those things to keep in mind, not an uncommon area for clients to start to get some aggravation and pain. Sometimes it's that bicep, right? You know, bicep inflammation or bicep tendonitis. Either way though, just to have a better idea, we do have attachment right here. So if we're talking about flexion, right? Flexion at the elbow, biceps are gonna drive that, but they definitely can also be involved in a little bit of movement at the shoulder, right? Not a lot of people think about that or know that, but that would be our biceps. And then really the last muscle we'll look at in this view before we flip back around is gonna kind of tie in. I'm not gonna go through all the muscles of the forearm because honestly you can see it's a pretty complex area of the body. Kind of like our lower body muscular anatomy, we've got a lot of muscles around the ankle. We've got a lot of muscles that connect here into our, our digits, create motion. But one of the more common ones that you might find with, let's say something like hammer curls, is gonna be the brachioradialis, kind of one of our medial forearm muscles. And that one you can see here I have highlighted, brachioradialis. And I mentioned this one because you've probably done different bicep curl variations before. Maybe supinated palms up, which you feel more just directing the bicep. And then maybe you've also done hammer curls, right? And oftentimes people might be able to do a little bit more weight via hammer curl because what you're doing is you're also bringing in this brachioradialis, all right? So this one, the moment I rotate to that neutral position, it puts that brachioradialis in a good mechanical advantage and allows me to train that. So an important forearm muscle that can also take over and aid in flexion there at the elbow. All right, so again, there are a lot more muscles. I'm not gonna try to get too complicated with it, but what we'll start to do is we'll start to work our way back around, and we're actually gonna start by going in a little bit. we're gonna talk about the rotator cuff, right? Rotator cuff. I'm sure you've heard this before. This is a group of muscles you not only should know for your certifications, but again, a very, very common area of the body that may have issues. A lot of people end up having shoulder dysfunction or pain over time. So we want to understand what's going on in there. So what I'm going to do is I'm going to try to, deepen our layers here a little bit, pull away a couple things. We're going to go back to our home view, get rid of there, and let's dive in a little deeper. So first off, you can see here, this is still an anterior view, and this is where it starts to get a little bit tricky. I'm gonna highlight this muscle so you can see it for a second. This is one of our 4 rotator cuff muscles. We have one that sits on the anterior, which means the front side of our scapula. And here's what we'll do. I'm gonna isolate it so you guys can see. That shoulder blade, our scapula, kind of sits back on the back of the rib cage. And on the anterior side of that, you'll see we have our subscapularis. Subscapularis, sub meaning underneath, and then scapula. So it attaches there. And this one, you can see, it kind of attaches more to our medial border of the actual humerus, our, this main upper arm bone. And what happens, if I think about isolated function, your subscap is going to be an internal rotator. The rest of our rotator cuff muscles are going to be external rotators. All right, so it does, if I think about training it with a band or a cable, if I pull the hand in towards my body, that's going to be more internal or medial rotation of the shoulder. That's going to be driven by the subscap. But what we'll find with the actual rotator cuff muscles is although they do internal and external rotation, one of their primary roles is just controlling position of the shoulder. Controlling position of the shoulder. This is an area I can even relate to. I had rotator cuff injuries from baseball, football, from getting in positions where the shoulder's trying to control position, and it's generally pretty weak, right? These are generally more like endurance-based positional muscles. But that's gonna be your subscap, just so you guys can see this. I'll tell you guys, easy acronym to remember it, SITS, all right? And I'll show you the order in which that goes. SITS, sits, is the easiest way to remember it. And the way we start that is now we can see here, now we're starting to look at a posterior view, meaning the backside. So we're looking at the shoulder blade, the scapula. And I'm gonna go in order of our acronym. On top here, one of our first external rotators is gonna be the supraspinatus. Supraspinatus sits right here, kind of this top border of the shoulder blade, and you can see comes out and attaches to the humerus. So isolated external rotation, but as we mentioned, it's kind of a stabilizer. So we have the supraspinatus. Then right below that, SI, infraspinatus. Supra means above, infra below, so supraspinatus, infraspinatus, which is a little bigger, still an external rotator. And then right underneath of that, right, it's even hard for me to highlight, that's where we get the teres minor. So SITS, supraspinatus, infraspinatus, teres minor, and then the subscap that we talked about. Those are your 4 rotator cuff muscles. And you can see how close those all connect in here. All right, so those are your rotator cuff muscles. And now what we'll do is we'll start to kind of build out. We're at this deeper layer right now. Let's build out some of our back musculature. As you can see, one of the unique things about our upper body that we don't have for the lower body is actually the shoulder blade, the scapula itself. It's kind of this floating mechanism that sits on the rib cage and has a lot of muscles attached. That might be one of the reasons this is more of a problematic area for people because there's just more complicated mechanics that are happening. We literally have an additional bone in this area that we don't have down here in the hips. So it allows for some more movement, but also more challenge. All right, so if we look a little, essentially right below that, we have what is oftentimes called the mini lat, because it kind of does similar motions. So we have our teres major. It's still a relatively small muscle, but it does a lot of similar motions to the lats. You can see this one, if we isolate it, this one really, it's a relatively small muscle, but creates some connection between our shoulder blade and the humerus. And it actually attaches, as I'll show you the lats again. We talked about the lats in our core video, but they're also a really important upper body muscle, is that this is gonna attach in a similar place. So when it comes to thinking about what is going on in the shoulder, this muscle is not only gonna help to adduct that shoulder and bring it closer to the body, different positions in my body, it may also be involved in kind of extension as well. And it's going to help essentially regulate that position between our scapula and the humerus. All right, so that's one muscle. And as we kind of go a little bit further out, we're going to also see here too, and I just want to tie it together because we talked about the lat. If I bring the lat in, you can see the lat kind of sits right over the top of it. All right, so the lat, it's an important core muscle, but as far as driving motions, look at the fiber run of those angles. Anything with the shoulder, if I'm bringing the shoulder down, extension, lats. From here all the way to here, right? We have more sagittal plane, then we have more frontal plane. Any motion where I'm bringing that arm down in any of these angles, the lats are going to be involved, right? The lats are going to be involved. And exercise-wise, you can think about pulling, right? Obviously, any of our horizontal pulls, vertical pulls, and everything in between, the lats are going to be involved in those motions at the shoulders, right? Really, really big muscle, important one for us to train, but truthfully, a tough one sometimes for people to get activated based on the exercises they're doing. So we have the lats there. We talked about that teres major, which is kind of like the little lat. And now we can look at a couple of other muscles here as we look at these layers of muscles that are connecting the shoulder blades to the spine. Here's where we got our rhomboids, right? Rhomboids. If you guys look here on the screen, it even shows retracts and downwardly rotates our shoulder girdle, which this means when I'm talking about retraction on my shoulder blade, pulling my shoulder blades back together, the rhomboids are going to be an important one. Also, when we look at all the motions of our shoulder blades, right, this would be downward rotation of the shoulder blade. Well, you can see where those muscles are from our spine into the lower portion of the scapula. When those shorten, they're going to downwardly rotate those shoulder blades. So that's going to happen with exercises like more vertical pulling, pull downs, pull ups, where we're getting some of that downward rotation of our shoulder blades. The rhomboids are definitely going to be involved. All right, so there's our rhomboid major. You can see right on top of that, we also have our rhomboid minor. Going to do some similar motions, but sits a little bit further up on top of the shoulder blade. All right, you guys can also see here too, we could get real complicated with muscles of the neck. All right, I'm going to try to keep it pretty simple for us. There's a lot going on here. If you guys are studying material like the NASM material, often inside of this, you know, the assessment information, posture position, the levator scapulae is one that comes up. And you can kind of dissect what this one does from the word levator, elevate, scapulae, scapula. So this one you can see connects kind of to this upper border inside of our shoulder blade, and then up into really, as we isolate it, you guys can see, really up into like our cervical spine. And so this one not only can elevate the shoulders, but it also has the ability to kind of change and tilt that head position. And these are areas, if you're dealing with clients or maybe you yourself, like some neck and trap tightness and issues, these are these areas where sometimes if we've got some weird shoulder motion happening, these are the muscles that get really, really tight and kind of aggravated up in this area. All right, so levator scapulae, pretty common, important one. And another one that I would say relates in a similar area, again, as you see, there's a lot of muscles here. You know, we could go through and talk about the scalenes and scalenus and everything else. We're not going to. We're going to keep it kind of highlighted, levator scapulae, and then also sternocleidomastoid. It's a mouthful, literally. All right, it's a lot, but that's another important one. As you see, create some connection from the base of the skull down to our clavicle and our sternum. And it's another one where, again, we can have some overactivity, whether it's due to like chest breathing, maybe we've got some shoulder issues. These are areas that when people go in and they're getting massage or they're working with PTs, chiropractors, oftentimes there could be some aggravation in these areas. But either way, just think about it. They help to control the relationship of our head to our cervical spine and really into these upper ribs. So as far as actual isolated function, these are ones you don't need to be worried as much about with common exercises, but just know they do often come up and they could be related to some other things happening here at the shoulders. All right, but from the posterior view, we covered the lats. I'm gonna throw next layer on top here. We got to talk about the traps. Same thing, we're just talking about this area of the body. The traps, you can see big surface area muscle, primarily 3 different angles of fiber run. We have our, easy enough, lower traps, middle traps, upper traps. Upper traps are going to be more, we think about shrugging, all right? Mid traps, more shoulder retraction, and then lower traps, more depression. And so we want to have the ability to do all these things. You know, this is a real common one. A lot of people carry a lot of tension up top. They might be weaker in these mid and lower traps. So another area that's not commonly trained. But you can see fans a lot of different areas and really has a strong connection between what's going on in the mid back to the shoulders and the neck. All right, so those are going to be our trapezius. We got lower, we got middle, and we got upper. We already talked about the deltoids back here. And then last couple muscles we're going to cover, you can see very much like our biceps on the front side as we look at the triceps, right? The unsung hero of the arms. You want to have big arms, get some big triceps. That's where it gets meaty. But triceps, 3 heads, try 3. All right, and you guys can see 2 of them here. The third one's a little harder for us to see, but they also kind of come up underneath of the deltoid. All right, so I'm going to hide a little bit of the deltoid. And let's also hide a couple of other muscles so we can just see what's going on. I'm gonna hide our infraspinatus. Cool. So you can see we have one of the heads of our triceps right here, the lateral head, which really just starts on the humerus and creates connection to the elbow. So if you think about that, because of where it starts and ends, it's only gonna be involved in extension at the elbow, right? Tricep extensions. But you see, our long head actually connects to our shoulder blade or our scapula. So as I start thinking about arm position, yeah, I'm gonna hit right here if I'm just going focused on more extension at the elbow, my lateral head, but also my long head. This is where doing things like sometimes playing with like an overhead position versus down next to the body. While I'm in that overhead position, I'm somewhat stretched. We call that like an elongated position of the muscle. It's gonna train it a little bit different, all right? But either way, sometimes you might even feel on exercises like straight arm lat pulls, sometimes you're like, man, I feel my triceps burning. Well, they're working to stop you from bending the elbow, but if you see, they actually attach to the shoulder blade here as well. So we have that additional attachment. And if I pull even away from there, right, that area of the body, you'll be able to see we kind of pop into here to a couple different areas and we can see what's going on. I'm gonna hide this, boom. Now we can get into, we got the brachialis, right? You get further into the coracobrachialis. But for the most part, main things we want to think about when we're thinking about the triceps, two meaty portions here are going to be these bigger heads. We'll go back to our view so you guys can see everything of just being able to see right here. There we go. Right back into these two primary portions. And funny enough, unlike our biceps, we talk about changing hand position to either get biceps or forearms. It's arguable whether any type of motion in the wrist really impacts our triceps because they're not really connected. It's more about extension of the elbow, all right? So those are gonna be some of the main muscles. Like we mentioned, there are a lot of muscles that flex and extend the forearm, probably beyond the scope of what we need to get into this video, but making sure that we are comfortable with these bigger prime mover muscles, the lats and the role that they play in shoulder motion, the traps, all the motions those are involved in, understanding how involved the deltoids are with pushing and pulling and stabilizing the shoulder, and then back to some of the muscles of the front side with our pectoralis major and pectoralis minor. So hopefully this video, guys, gives you guys just some better visuals of what's going on in the upper body. You know, definitely not only so we know what muscles we're training when we're doing certain exercises, but also so we can help clients problem solve some of the issues they might have going on. And I can tell you from experience, from years of training, the shoulders in this upper body area is definitely one where you find yourself working around certain exercises based on the clients that you work with. And if you guys want some more help with muscular anatomy in general, make sure you guys check out the link in the description below. We actually have built out for you guys a muscular anatomy guide, especially if you're studying for your exams and you're trying to memorize these muscles. This has blank charts, great visuals in there for you guys to use when you're studying, or if you're already training clients, just to have a better idea of the muscles you're training when you're in the gym.